invite me for this. This topic consists of multiple topics. Actually, I have been given multiple topics and I have to cover everything in half an hour. It will be a difficult task for me. I'm just going to give you an overview. But in case you need to understand more about it, we are always there to help you as a DHR person. I'm there to help you, and Dr. Sahu along with me, he can also help you in doing systematic reviews as you are all learning today. So today we are going to talk about, since morning we've been hearing about systematic reviews, the way systematic reviews has to be done, the literature search, and you find that it in your hands-on you would have realized that it is very difficult to do a systematic literature search. It's easy to speak, but when we start doing it, it's difficult. So, but we have to understand the methodology, the standard operating procedures. It is a scientific way of doing things, and it is necessary for us to understand all the steps in systematic review. So this is another step in systematic review where we will be talking about standards of reporting, the importance of prior registration of the protocol, the various critical appraisal methods, and also the quality assessment criteria. How do we next? Click since morning. So what is Prisma? Prisma is actually a reporting standard for systematic reviews, because the ultimate aim of any researcher when he does research is not just to do research and forget it. He has to publish it, right? So Prisma is a method of it's a guideline, not for conducting research, not for conducting systematic reviews. Let us all be very clear that Prisma is not a method of conducting systematic reviews. It is a guideline for reporting systematic reviews in journals. So Prisma stands for Preferred Reporting Items for Systematic Reviews and Meta-Analysis, and I have given the link for each one of them here, and we'll understand what it is, what are the steps involved, what are the questions that is asked in a systematic, in a Prisma, and how do we report our systematic reviews. So as I said, it is not a conducting guideline, it is a reporting guideline. Please, when you publish your article, I have read many articles, very lot of systematic reviews where they say that we have conducted a systematic review as per Prisma. No, it's a reporting guideline. So it's a item checklist of 27 items, and we'll be understanding each one of them today and how to report these items in a published systematic review. So there are separate sections for a system. You on the right hand side, you see the Prisma flow diagram. We have been seeing this since morning, and we know that it has to be there as part of a publication of a systematic review. But we have to understand the nitty gritties, the details of what goes into each of these, what do you call these boxes. And these actually consist of about 7 sections, and what each section means we are going to see. The first one is the title. The group with whom I was working, I was telling them that whenever you do a systematic review and publish it, please mention it in the title as a systematic review. You otherwise, even when an umbrella review is done or somebody is trying to search a systematic review, it will not come in the search if you don't give it as a systematic review. So it's a good practice to title your study, whatever you want to do, the research question, the PICO will come in the title, but along with it, at the end of it, say it is a systematic review. And if a quantitative analysis is also done in that, then you say systematic review and meta-analysis. Okay, so that is something that you need to see. Some of the examples are given here where the authors have stated it as a systematic review in the title itself. The second important item of Prisma is abstracts. So when we look at the checklist in the Prisma checklist, we see that the abstracts has to be given when you report the systematic review. The abstracts has to follow the Prisma statement, which is a abstract guideline for reporting a systematic review. The abstract guidelines can be clicked on this, and you can go to the abstracts, and there are about 12 items within this Prisma abstract guideline. So we have to follow these. It includes the title of this report, the objectives of the study has to be explicitly stated, the eligibility criteria of the participants of this participants who are included in the study from the primary studies, the information biases, the risk of bias, method that has been used. We'll be doing some of them now. Synthesizing the results, how the results are synthesized, the ways the included studies have been included in the review, and the ways, the methods used for synthesizing. What methods have been used? Have you used an odds ratio? Have you used a risk ratio? Or is it something else, hazard ratio or whatever? So all that has to be covered in the abstracts also when you report a systematic review. The second thing that you have to see, something has gone wrong. Yeah, कुछ हो गया. Can we go back? Escape कैसे करते? Down arrow से मैम आ सकते हैं, up arrow से. Escape नहीं होता है इसमें. Escape करते हैं. Escape बटन दबा दीजिए. Escape कर जाएगा. Where is it? Left side पे top पे. इसमें. अच्छा इसमें. Oh, it's there. Oh. It's not moving. It got stuck. वो पावर पॉइंट पे जाना पड़ेगा. ये चला गया, इस पे नेट पे चल रहा है. नेट पे चला गया. यहाँ से पावर पॉइंट पिकअप करेंगे. ये. अच्छा ठीक. Okay. So the next one is introduction. The next item in the checklist is introduction. So there are two questions, two items in the introduction. One is to describe the rationale of the study, and the second is to explicitly state the objectives of the review question. Here is an example where we have cost of lung cancer, which is a systematic review published in 2023. And if you see the underlined portion, the highlighted portion, it starts with an introduction about the global status of lung cancer, and somewhere in the end of the introduction it tells you what is the rationale, what was the objective of the researcher to do this research question. Then the next step or the next item in a published systematic review is the methodology, which is going to be an extensive detail of how you have included the studies in the review, what are the databases, what are the registers, what are the websites, what are the reference lists that the reviewer has seen, and it has to be clearly documented and presented in the review when you publish the review. You have to publish the entire search strategy. So remember that when you create a search strategy, you have been doing that in the morning, it doesn't happen in one go. You have to keep doing and doing it again and again. Pull out some primary studies which will be included in your review, read the primary study clearly, and take out the synonyms or the common terms that are used that represent the P or the I or the C or the O component of the PICO question. So it is a repetitive process, and only when you when you saturate that process, then the search strategies are clearly defined. So all search strategies should be, all search terms should be clearly documented, and it has to be attached as a supplementary material when you report your systematic review in a paper. So that we have to clearly understand. And this also, the methodology of including the ways the databases are searched, the registers are followed, it again has an extension. You have to follow a Prisma S extension, which is also available, and the link is given here. This is the link for that, and you just click on the link, and there is a list of items that has to be covered to specify the inclusion exclusion criteria and the databases that are going to be seen by the researcher. So we follow this, and that is how the fifth, sixth and the seventh item in the Prisma checklist is addressed. The next comes in the methodology is to specify the methods and the eligibility criteria that has been followed, how the data has been collected, what are the data collection methods, the techniques used for data collection, the description of the outcome parameters, other variables, the confounding factors or any other variables that are part of your of the primary study needs to be defined clearly, the risk of bias methods to be addressed, the effect measures to be defined first. The if you have to put the formula here, what's the formula you are using for odds ratios, what are the other effect measures that you are seeing, are you looking at a risk difference or are you looking at an hazards ratio, all that should be part of the methodology. Again, continuing with the methodology, a methodology has 11 items that cover the checklist of Prisma. The other things that you have to put in the methodology is how the studies have been synthesized, what are the methods to prepare the data, how are the data cleaned, what is, have you addressed missing data or not, whether the data needs to be transformed. Sometimes what happens is you may have to use some log transformation to transform the data in the manner uh, that can be used for analysis, that needs to be addressed here. What are the synthesis methods, are you following a quantitative method, are you planning to do a meta analysis, are there enough quantitative measures for synthesis or not, if not, are you following a qualitative method, all that has to be also put in the method section of the paper. The heterogeneity, if you are doing a meta analysis, are there sources of heterogeneity? Are you following any statistical method for addressing heterogeneity? Are there reasons for heterogeneity? If there are, that all needs to be added in the method section. Then comes the results. So the results section describes the results of the search, the results, the citations that have been included, the citations that have been excluded. Because if you look at Cochrane review, then all a detailed list of all excluded studies are also put as part of the Cochrane review. So all that has to be written in the report, and also the presence of risk of bias and how we have addressed it, all the summary statistics, the 2 by 2 tables, the odds ratios, the combined results, the and then the forest plots, the graphs, all that, the bubble plot, all those, not the bubble plot but the funnel plot, all that has to be added in the results section. Then the results further try to look at the synthesis, and the overall synthesis is presented with limitations. All the assessments, the certainty assessments have to be put in the result section. The interpretation and discussion for everything, for the general interpretation, for the limitations of the evidence, whether there are some limitations in the review process itself, limitations in the access of data, limitations in the language of the review, all these needs to be put in the result section. Then if any sensitivity analysis has been done, I don't know how much we will be able to cover in this workshop, but maybe in a detailed workshop the methodology can be addressed separately, where the various methods of doing meta analysis can be seen. Then comes the other information, which also is part of the Prisma checklist, that tells you about the registration details of the review. Has it been registered in a particular website like Prospero, and any financial or non-financial support system was there for the review or not, whether you have a protocol which has been published, and if it is published, can we access the protocol or not, all those details are put in the last section of the checklist. So what we try to say here is that when you publish the systematic review, all these have to be addressed, and you have to actually tell to the editor of the journal that in which page this particular item is there in your review. Okay, you have to put the name, page number of the review manuscript paper when you publish this study. Now, talking about the protocol registration, we've been saying since morning that we need to register the protocol for various reasons. It helps in reviewers help. It helps in the in planning the review properly for the reviewers. It is it becomes an explicit document. It is a scientific document, and they need to start the review with a certain protocol. It is necessary for us to follow a protocol system, and it also helps in avoiding duplicacy, because many times, the same protocol is the same idea is generated in another researcher's mind, and he will also be doing a similar kind of study. To avoid duplicacy and avoid expenditure of useful resources, it is better that you register the protocol in a particular website. But many people don't know where to register and how to register, so we'll see how to register. So there are various websites where your systematic review protocol, once it is finalized, all the reviewers have seen it and they have given their feedback, then you plan to register the protocol. And the most common website where you can register the protocol is the Prospero website. It's free of cost, and it is available since 2011. It is free, and it accepts all kinds of systematic reviews, but only problem is it accepts only systematic reviews. So if you plan to do a systematic review, you have created the entire structure of the protocol, you can immediately register in Prospero. So there are steps involved in the registration of a protocol in Prospero, but these are very useful and very learning lessons for you, how to register your protocol in a Prospero. And you can use the same registered protocol with some fine tunings, and you can submit it as a publication in a journal. So the Prospero registration promotes transparency. We have seen that in the morning. It avoids duplications, but it at the same time enhances scientific rigor and protects the researcher against selective reporting. Because once your protocol is published, we've seen in the morning that once you publish the protocol, then you have to follow the protocol as it is. And not all funding agencies, but some of the funding agencies, they have made it now mandatory to have your research or your systematic review registered in a proper website, and that is Prospero. Some of the journals have made it mandatory, and they have started endorsing the registration of the protocol in the Prospero. And Prospero gives you a protocol ID, and you can use that ID when you publish your protocol in a journal. So, and it helps a lot for the funding agencies also. The other website where you can register your protocol is Research Registry. The Research Registry was started in 2015, and it is available for all types of systematic reviews and meta-analysis. You search on the website and you will get Research Registry, and you have to do some initial form fillings, and after that you can register your protocol in this. The third one, inplacy.com. Inplacy.com has been available since 2020, but this is a site where it takes money for registration. About those days it was about 21 US dollars. But if it is a funded project, if your systematic review has been funded by an organization, you can try to do that. And uh, there is a provision for updating the registration of your protocol for a for some price, and it accepts all systematic reviews and scoping reviews, and it also provides you a DOI, which is good because you can show it as a publication. So inplacy.com is a useful website. Then there is one which has been developed by Center for Open Science, and it is called the OSF. I think it is Open Source Forum, and it is available since 2019. It is free, accepts all study design, so not necessarily systematic reviews. If you are doing primary studies, that also can be registered in this website, and it provides you a DOI. which is good for you. And then there is one called protocols.io, which is again available free from 2014, accepts all study designs and provides you a DOI. So it helps you to spread your research to a larger scientific group. So these are some of the websites where you can publish your protocol. The next topic that I have to cover is critical appraisal. Since morning we're talking about critical appraisal. What is critical appraisal? Can anybody say? What do you mean by doing a critical appraisal of a study? क्या होता है? Say something. हाँ. So you are trying to understand the research that is published, and then you are trying to evaluate it through some systematic method explicitly, isn't it? Using some explicit methods. So that is what a critical appraisal is. Critical appraisal is a careful appraisal of the study's trustworthiness or its methodological rigor. Why it is necessary? It is necessary because that is going to generate evidence for you. So a study which has not been done properly, which has not been designed properly, which has not been analyzed properly, will not give you the kind of evidence that you are looking for. So the three major things that a critical appraisal method does is look at its validity, look at its trustworthiness, its value and relevance in a particular context. So whenever you read a paper, you have to relate it with the settings in which you are working, whether your patient will be benefited from that or not. So that is important for you, and that is what a critical appraisal of a paper does helps you in. It allows you in reducing the information, that is information overload, because lot of studies are there in front of you, and you would like to include only those studies which have quality, which have value. So only those valuable information will be synthesized for systematic review. It identifies the most relevant papers. It distinguishes evidence from opinion, from misreporting, and from just belief systems. So ultimately, it is trying to assess the validity of the study and evaluate the usefulness and clinical applicability of the study in your kind of setting. So, what are the key questions, the most common questions that are asked in any critical appraisal? I will not be going into the details of the various critical appraisal tools, but what we see here in most of the critical appraisal tools, these are some of the common key questions. Is the study relevant to any field, to your field or not? Is it a relevant study for my field or not? Does the study add anything new to the evidence in my field? What type of research question is being asked? Because we have been in a systematic review workshop, the first thing that we try to understand is how to frame a research question properly. So has it been properly framed or not? So what will a well framed research question have? What components will a well framed research question have? What are the key components of a well framed research question? Hmm. Pico. Pico. So if a research question has the Pico properly written, then it is easy for you to do a search. It is easy for to write the methodology, the inclusion exclusion criteria. Everything is very clear. So a well framed research question should have the Pico intact. What was the study design? Was it appropriate for the research question? Where we've seen Dr. Lohia talking about the study design. uh, is it appropriate for the research question, or should we do an RCT, or should we do a observational study or a prevalence study, or whatever, depends on the research question, right? The research question, the outcome, everything. Did the methodology address any important source of bias? So we've seen in the morning there were n number of sources of bias. The most important ones were discussed in the morning: the detection bias, the publication bias, you know, all those biases. Does it address all these important biases or not? Does the study population represent the patient population or not? Is it a representative sample from a patient population? And was the study performed as per the original protocol? Because your protocol is already published, and whether it is being followed or not is something that you will see. Because whenever you read a research question, RCT, then even the RCT protocols are these days published first. So if the protocols are published, has it followed the protocol or not is something that you need to ask. Does the study test a stated hypothesis? Have they made clear statements of what to expect from the study? Has it been stated clearly or not? Was proper appropriate statistical analysis done or not? Because somebody was saying that we do a gender and we say 1 plus 2 is equal to 1.5. We do a appropriate, we don't do an appropriate statistical analysis. For categorical data you may use a t-test. How many of you use a t-test for categorical data? Yes, it is used for quantitative data, but sometimes they use it for categorical also. That's wrong. So we use the appropriate statistical analysis. Do the data justify the conclusions, or do we need to do more analysis? Are there any conflicts of interest between the reviewers? Because as we've said in the morning, that you should not do a systematic review alone. Please take with you at least one more reviewer and a third reviewer to adjudicate when you both are under disagreement. So all at least three reviewers have to be there in any systematic review. And ultimately the question that the reviewer of the primary research would like to know is whether does it help it manage my patients or.
It is 20 question very relevant है. They precisely mention domain intervention, PICO क्या है, domain क्या है, context क्या है, whatever this ना, you have to carefully address all the point. But most of the time ना आप अगर उसको सही से लिख दिया ना,
उसको एज इट इज लेके ट्वीक करके आप उसको पब्लिश कर सकते हो.
study where registered prosperous some other registration sites are mentioned. Is there any way that we will know that this same study has not been registered in other databases?
No, there is no linkage.
ये नहीं करना चाहिए actually. क्यों करना? See what happened now. I have a experience that we conduct one systematic review in the mental health related area, MPH students. We completed the study, registered in Prospero, everything, and we thought to submit it in the IJP, Indian Journal of Psychiatry. But unfortunately, just before 2 days, when we already ready, everything done, we did it. Then some study exactly same, somehow different, but not good quality, published. But that was not registered in Prospero. Our whole effort is. Nee, then we modify it, our objective, we change it and everything. Then we published in other journal. Then we wrote to the journal editor also. Otherwise, also other way, you check the Prospero database. If somebody is doing, you can do without Prospero registration same study, but it is not guaranteed that your study will be published. Will not be published. इसलिए पहले ना अच्छे से चेक करो. पहले तो सिस्टमैटिक रिव्यू होना नहीं चाहिए पब्लिश्ड. Then you also go through the Prospero and other database, either similar study is going on or not. Then if someone is conducting, don't go for that. You will be in suffer. You will be put more effort, then it will be not get published. Sir, Prospero also asks for the deadline. By this deadline.
हाँ वो देते हैं पर वो फॉलो नहीं.
वो देते हैं strict. आपको minimum 6 months कर दो, ठीक है? Then you can continue even before you can publish also. They will be happy. You have to update it. Suppose sir, we are not able to complete by the deadline. Suppose. So nothing will happen. Nothing will happen. But 2-3 years का बाद ना वो ऑटोमेटिकली चले जाएगा और कोई कर रहा है. ऐसे नहीं है मैं एक रजिस्ट्रेशन करके 3 साल तक छोड़ दूंगा, कोई नहीं करेगा. when you are reviewing the Prosper also, see when they registered also. So ऐसे नहीं उनका database update होता आजकल तो AI हो गया. You know that maximum year of Prospero registration is not reviewed by that. It is AI related review. इसलिए very careful when you are writing the keywords. Prospero में automatically आपका जो result आ जाता है ना वो AI based review होता है. इतना registration हो रहा है. How much you will spend if you engage HR for reviewing? So इसलिए ना carefully आपको keyword क्या सर्च करना, health related outcome है, so and what search strategy will go, that is very important.
Sir, conducting review, question to ma'am, conducting guidelines you mentioned was reporting guidelines was Prisma. Are there any conducting guidelines?
Conducting guidelines तो सुबह से हम देख रहे हैं ना, what are the steps involved. You have to collect, you have to first frame a research question, give an explicit inclusion exclusion criteria.
So like Prisma in a format, the checklist, everything.
No, Prisma is for reporting. Conducting is the Prisma guides you in conducting also, but it is not a conducting guideline. It is a reporting guideline. So you are following it to report.
So is there any similar?
I already answered that question. No, when you are using Prospero, Prospero is a guideline. Means why you do registered in Prospero? Because
your protocol is your guideline.
Your protocol is your guideline because Prospero में जो TICO क्या है, context क्या है, ये क्या है, everything you have to write down. That means you are following the guideline. Unless you follow that, you will not register. Then you can say also.
जैसे में synopsis लिखते हो, यहाँ पे protocol लिखोगे. तो जब protocol तुम्हारी approve हो जाएगी, उसके बाद काम शुरू करो.
Yes, it's a guideline because you are following the structure.
प्रोटोकॉल का तो यूजुअल गाइडलाइन होता है ना, इंट्रोडक्शन, ऑब्जेक्टिव्स, एम्स, मेथड्स, रिजल्ट्स नहीं आएगा.
How to data extract the data, what software you use, how to do heterogeneity, everything you have to mention. What is your outcome, secondary outcome, primary outcome. So that is your protocol. That's why you are registering, no?
अगर आपने पहले काम भी शुरू कर दिया तो आप उसके बाद भी रजिस्टर कर सकते हैं. नहीं रेट्रोस्पेक्टिव
बट बताना नहीं
आपने लिटरेचर सर्च स्टार्ट कर दिए हैं तो आप उसमें मेंशन कर सकते हैं कि हमारा लिटरेचर सर्च स्टार्ट हो गया है. नहीं रेट्रोस्पेक्टिव तो अलाउ नहीं है कि ऑब्वियसली आपने एनालिसिस
we'll be doing it